So thank you everyone for being here. Um, so you may notice that we have 6 faces on screen and only 5 chairs over here. That's because Mithea has won't be able to make it in person today. So she's provided a recorded video address. Um, yes, so we'll get to that later. Uh, I'm really uh, I just feel very lucky to be here with all of you from very different geographies and disciplines. And I'm glad that we can come together and that you have the opportunity to share your research here. So uh, for the kind of higher level researchers in this room, I hope you can learn uh, from researchers who may not have had like as big of a platform yet to share their findings. Uh, yeah, and I just hope that this inspires more collaborations. Um, I'll just quickly introduce everyone. Uh, so this is Dr. Hisham Akhtar. He's an associate professor at the Global Health Department of the Health Services Academy in Islamabad. Uh, this is Esteban. She's a public health graduate from the University of Philippines, Manila. And her research focuses on climate and mental health. Um, and she's also been involved in the Connecting Climate Minds initiative, which I'm sure she'll get into later. Um, this is Dr. Xiangren Tan. Um, he's a senior research fellow at the Heat Resilience and Performance Center at NUS. Um, and he has more of a background in exercise physiology, but his work intersects quite interestingly with climate and mental health. Um, this is this is Christina Chen, who's completing her PhD in integrated biology and medicine at Duke-NUS Medical School. Um, and she has a background in psychology. Uh, yes, I will let everyone introduce their own work a little bit more. Since Mathea can't make it in person today, I'll just share a little bit more on her research. She's an early career researcher specializing in global health, climate change, and disaster resilience. And her work centers the lived experiences of fisherfolk and health workers in coastal communities in the Philippines. So this is quite a, yeah, this is quite a diverse group. I realized I forgot to introduce myself as well. I'm Tanisha. I'm a research assistant at the Planetary Health Initiative at the Sing Health Duke-NUS Global Health Institute, which is quite a long name. Basically, the Planetary Health Initiative's research focuses on climate change and health uh, at this early stage. I've been fortunate to work with Dr. Enzo Ginto in this area. Um, I'm interested in mixed methods research, that mixed methods and applied research for vulnerable groups being affected by climate change. So it's really been a privilege to be part of organizing this conference, from hearing from everybody so far today. Uh, I'll just let the presenters take it away. We'll start with Dr. Akhtar.
So should I
Yes.
start the
Yeah.
presentation? Good afternoon, everyone. I am Dr. Hasham Akhtar, and I work as an associate professor in the Health Services Academy, Islamabad, Pakistan. So after this mindfulness and the meditation, I'm here to give back the stress and the depression and anxiety back to you because because this is all the earth, the climate is all about nowadays. So today I'll be talking about this psychological effects of climate change, mostly the eco-anxiety, depression, and post-traumatic distress disorders among flood affected areas, especially the northern part of Pakistan. So as we all know that climate change is no more environmental factor. It's psychological effect. It's a health or public health issue, and the world is facing the consequences. So mostly these frequently extreme weather conditions like flood or droughts, they have come up with a lot of health issues like depression, anxiety, and what do you say it? Stress. So our study aims to assess the mental health consequences of these disasters and explore ways to mitigate them. Basically, the northern part of Pakistan is very vulnerable. Most of the Asian countries are vulnerable, but Pakistan is in the top five vulnerable countries affected by the climate change, and they have their effects on the mind. So basically, the flood of 2019 to 2022, they have affected around 90,000 people. They have been displaced. The disasters, they have caused the displacement, the financial losses, and a significant trauma on their life. So these numbers are in millions. In September 2000 to 2022, the claim is around 1 million people they were affected, and Ross has they have affected around 7 million people. Million of acres of land has been affected. So this has brought us to the food security and the health issues. Um, the floods of 2024, they were very much they were horrible, and people were really affected with the consequences. So the research objectives were to we were basically trying to assess the severity of the depression, anxiety, and stress among the affected people, and to examine the impact of eco anxiety on the mental well-being. So we were also looking after the demographics, and we were trying um, to touch the policy development section of Pakistan also. So what we can do, and what how to do it, where to start with. So basically, coming towards the methodology, it was a cross-sectional study in Bahrain's north part of Pakistan, and 388 participants were taken in that study with face-to-face interviews. It was a mixed method study, and the generalized tools were the DAS-21 for the depression, anxiety, and stress. We used the GAD for the diagnosis of the anxiety, and then we used for the depression PHQ-9. And the picture that you see on this screen is it's not after the flood. This is not for the helping out the affectees. This is the daily life of those people for next few years. They cross the river by this to take this food to their house. Okay, so the effect is long than what we can see it. Okay, and so in our study, majority of the participants were male. I'll tell you why, because there is another effect of gender equity on those areas. Okay, and 74% were married. Education level was very low, and like 41%, 41.8% were uneducated. So majority were middle economical status, and few were from the high economical status, and most of the individuals, like 56.4%, recommended, like they had good hours of sleep, but 20% could not sleep because of the floods. And the data is of, like, it's around maybe 2 weeks after the flood. Okay, and there were many chronic diseases because of the flood, also the GIT disorders, but hypertension and diabetes was also profound there. And with the multivariate analysis, we found out, like, the marital status was a very big issue there. The widowed or the single living mothers, the depression and the anxiety was very high, And same was the case with the economical status. The high economical status were very worried about the after effects. The anxiety was there, was high in the high economical status. Living alone was another issue. People who were living alone were more anxious, more depressed, and there was a there was another trend of high exercise rates with high depressions, and lastly, the highly educated people were more stressed out. So this is the picture of the women, how they look when they come out of their house. Okay, so this is the dress they have to wear when they leave their house. Okay, so the study actually gives us a very high percentage of depression, which was 74.5% from moderate to extremely severe. 93.6% from moderate to severe anxiety, and 72.7% of distress. So levels of stress, anxiety, and depression are very high. These factors, the key findings are whatever I told you about the marital status and the age limits and the living alone, or the economical condition of their house, financial condition of their house. So these conditions, they actually affect their depression, anxiety, and stress levels. And the analysis highlights the complexity of how the demographics and lifestyles factor interact with the mental health, with some factor showing stronger associations, and other they have like a very strong association with the mental condition of the people. And these conditions, they stay there for longer period as we think about them. So what about the policy? What about the policy thing? So first of all, we recommended that we should integrate the mental health services in the disaster response programs, which is actually not doing, like Pakistan is not doing it. And we should establish community-based counseling, counseling centers. We should also include this in psychological first aid programs. We haven't heard about them in Pakistan till now. So there are many people. I'll show you a graph after this. There are many people that they are going to the clinics, the psychological clinics, to the doctors, but the count of doctors is also very less. People working there are very much in low numbers compared to the affected people. And we should develop the targeted interventions for the vulnerable groups like women or living alone or divorced people. Or then we should enhance the public awareness on the eco-anxiety, climate relevant stress, and we should lastly incorporate the climate-induced mental health concerns in the national disaster management programs, which is very much there after COVID in every country. So, in conclusion, I would say that immediate policy interventions and mental health support systems, they are crucial to mitigate these effects. We were actually talking about mitigation since last 2 days, and this is how we can mitigate it. This is the team that works with me, my colleagues, and the institute I'm working with. Thanks to all of them, especially to Dr. Mia Nizam. He's a psychiatrist working in Bahrain since last 15 years, and since last 5 years he has been volunteering the activities on the mental health. And this is the ratio of what happened after 2020. The rate of people coming to the clinic have raised like maybe 10 times. The OPD, the patient coming to the clinics is around 100 to 150 patients per day now, and they were around 19 or 20 or back in 2012. So people, the stigma has been broken. People have started coming to the clinic. So maybe it's like it's your turn or it's our turn to come forward and do what we can do. So with this, I'll pass on the ball to your court, and we have to decide what we can do. Thank you.
So we'll have a Q&A session at the end where we'll collate all the questions and then uh, ask all the presenters because we're a bit short on time. Tris, if you'd like to come and present your work.
So, good afternoon, everyone. As Tanisha mentioned, I'm Tris, a climate and health researcher from the Philippines, and I feel great honor to be speaking in front of you today. I've always been passionate about the environment, and during my undergraduate years, I was very fortunate to work with a team who share the same interest in climate change and mental health. And so here I am presenting our study, Climate Anxiety and Depressive Symptoms Among Undergraduate Students of a College in a Higher Education Institution in Manila, Philippines. Since this morning, we've been learning how climate change is one of the greatest threats to human health, especially in populations that belong in the global south. The Philippines, for example, ranks 17th worldwide among countries most affected by extreme weather events. Studies have acknowledged that climate change also affects mental health, and an emerging concept that encompasses the anxiety and worry that we feel that's in relation to climate change and its effects has been coined as climate anxiety. This phenomenon commonly affects younger populations. A global study revealed that the majority of youth respondents felt very or extremely worried about climate change, and almost half even reported that these emotions affected their daily lives. In the same study, the Philippines had the most number of climate anxious people. Climate anxiety has been linked to negative mental health outcomes. And mental health and depressive symptoms remain to be pressing issues among Filipino youth aged 15 to 24 years old. Approximately 10% of this demographic suffer from moderate to severe depressive symptoms, and climate related disasters, which are very common in the Philippines, continue to take a toll on the mental health of this population. Despite this, we Filipinos are known to be resilient in times of crisis owing to our faith and tight knit cultures. Now, climate anxiety has been gaining attention in Western countries, and yet there is still a significant lack of studies that involve populations from the global south. This prompts the importance of investigating climate anxiety and its effects on mental health in countries that are more vulnerable to climate change, such as the Philippines. And this is where our group makes our little entrance. Our study aimed to shed light on the relationship between climate anxiety and depressive symptoms among Filipino undergraduate students. We aim to determine the proportion of students with high climate anxiety and depressive symptoms and calculate the association between the two. To do this, we employed an analytical cross-sectional design and used a convenience sampling method. Our data was collected through an online survey distributed via email in December of 2022. We included undergraduate students aged 18 to 24 years old who were enrolled during the first semester of that academic year, and we excluded those who have been diagnosed with a mental health disorder. Our questionnaire collected sociodemographic data and religiosity, and we treated these as confounders. You can see our sociodemographic data on the slide. And we also collected climate anxiety and depressive symptoms levels. We use the climate change anxiety scale to measure climate anxiety, while the patient health questionnaire 9 was used to measure depressive symptoms. All our data analysis was conducted in Stata. The confounding variables were first screened through simple logistic regression before including in the final model, and in order to calculate the association between climate anxiety and depressive symptoms, we performed a multiple logistic regression analysis. Data from 148 respondents were included for analysis, and as you can see here, 22 respondents, or 14.9% of our respondents, had high climate anxiety. While here, 62.8% of our respondents have high depressive symptoms, and this is actually considerably high. You can see here that 3 confounders were included in our model. That's gender, natural calamities experience, and household monthly income or socioeconomic status. And you can see a positive relationship between climate anxiety and depressive symptoms. However, this relationship was not significant. Our study has revealed that there is already a proportion of students in the college who experience climate anxiety. And our study is actually one of the very, very few that measures climate anxiety among Filipino youth using the climate change anxiety scale. On the other hand, at least 6 in 10 respondents have high depressive symptoms. And this can be because of the freshly lifted lockdowns of during the pandemic when we collected our data, or even academic pressure that tends to increase stress and possible manifestations of mental health outcomes such as depressive symptoms. Now, there are varying results available on the relationship between climate anxiety and depressive symptoms. So, for example, similar to our study, a study among Australians did not find a significant relationship, while a study among Americans did. Still, a growing body of literature has linked climate anxiety to negative overall mental health. This suggests that while climate anxiety affects mental health, it may not necessarily co occur with or manifest as depressive symptoms. Possible protective factors and coping mechanisms may also be present in our population. For example, the Filipinos culture, which is centered around community and camaraderie in times of crisis or disasters, can promote resilience and help with coping. However, we did not measure this as this is beyond the scope of our study, but some researchers already explore this area. This is also the right time for me to emphasize that climate anxiety is not a clinical disorder. It should not be pathologized. Scholars have thought of it as a rational reaction to the uncertainty that the climate crisis brings, and it is more closely related to fear and worry about the future. In fact, climate anxiety can drive adaptive coping mechanisms such as pro environmental behaviors, climate activism, and climate mitigation strategies. It is therefore imperative that we focus on this productive pathway over the pathway that leads to negative mental health outcomes. Of course, our study is not without its limitations. The design, sampling method, and sample size may have affected the generalizability of our results. But still, several biases may have also been present, but we did make our best efforts to control them. In conclusion, our study verifies the presence of climate anxiety among Filipino undergraduate students and also reveals a high proportion of those with high depressive symptoms. While a positive relationship was found, this was not statistically significant. Again, climate anxiety is not a disease. Our efforts should not be directed towards finding a cure, but rather towards targeting its underlying cause, which is the climate crisis itself. Advocating for climate justice, demanding accountability from major carbon emitters, our collective action as a community. These are the keys to drive systemic changes that are necessary and that can benefit not only the climate anxious, but ultimately the entire population as well. We cannot do this alone. And of course, fortunately, we are not alone. And as cliche as it may sound, we're all in this together. You just imagine Zac Efron and Vanessa Hudgens dancing in front of you. That's supposed to be a GIF. So before I end, please enjoy a picture of our brilliant team during our graduation so you can see very happy faces of students who finally made it out. In the Philippines, we have a word, padayon. You can see it there. It means keep going or continue moving forward. And this morning during Miss Antea's Menti activity, I saw a very similar thing. It said, our existence is our resistance. And so we cannot lose hope, we cannot give up, and we shouldn't stop. And that should be our everyday reminder. So with that, thank you all so much. Good afternoon, and I hope everyone will padayon.
Thank you, Tris. Um, yes, we can move on to Xiangren now, but I think one common theme that I've seen in the research so far is establishing evidence on outcomes and pathways in contexts that are like highly understudied. So I want to just thank you for your work. Xiangren, take it away.
Thank you. So good afternoon, everyone. Just want to have a quick disclaimer first. I'm probably the odd one out that have never done anything relating to mental health. I'm gonna explain a little while later why it is so. So I'm actually a senior research fellow at Heat Resilience and Performance Center at National University of Singapore. So at HRPC, we are interested in research relating to heat stress and its impact on human health and performance. So here I'll briefly share about some past research that I've done that's relating to the impact of heat stress on human brain, and also I'll highlight potential implication for mental health. So you look at the temperature spiral diagram on the left. So this is the most visual way to actually see how rapidly our world is heating up. And we have just crossed the 1.5 degrees Celsius mark just last year. And it's projected that 14% of our global population will actually be facing at least one severe heat wave every 5 years. And by 2050, 2/3 of our population residing in cities will actually be affected by deadly urban heat waves. So living in the heated world also means that we face new physiological challenges that will actually affect the way that we live. So we will face risks of dehydration. We also faces new risks of heat strain due to the increase in body temperatures. So these will also affect the structure and function of our brain, which I've actually investigated using some MRI-based studies using the neuroimaging techniques. So in one of our earlier studies, we actually look at how dehydration impacts the brain. So what we do is to put participants on the treadmill, and then they run on the treadmill until they lose 3% body mass, so they are dehydrated. And then we put them through the MRI scans. So what we have found is that this induced exertional hypohydration actually led to transient structural changes in the brain. So specifically, there's a shrinkage of total brain volume with an corresponding expansion of the brain ventricles. So what this means is that you can see the impacted areas in yellow involves the frontal cortical areas, the middle temporal and occipital lobes, which could impact short-term cognition as demonstrated by other studies. So apart from dehydration, we also can talk about heat strain, right? So we have actually investigated these using randomized controlled trials. So we expose participants to heat stress, exercise heat stress, by putting them on treadmills where they run till 60 minutes or when they hit 39.5 degrees Celsius. So that's a very high body temperature. In a separate trial, we actually expose them to passive heat exposure. So instead of running on a treadmill, we put them into a tub where they are immersed in 41 degrees Celsius water until they hit the same temperature. And in the third trial, we actually added a cooling measure where they ingested blended ice as a way to reduce the level of heat strain. So after running or immersing in the tub, we actually wrap them up in this thermal suit, which is water perfused with circulating hot water, while they're actually in the scanner doing motor tasks and cognitive tasks. So what are the findings that we have? One of the key findings, and in fact a very novel finding, is that at baseline or a resting state, our brain temperature is consistently higher than our body temperature, about 0.6 degrees Celsius. And if you look at the green lines, with the green dotted lines, even as your body temperature falls, the brain temperature is still higher than your rectal temperature. So this tells us that the brain is actually regulated in a narrower homeostatic range, telling us that any excessive perturbation to our brain temperature can actually affect its proper functioning. So due to the heat exposure, there's also a significant reduction in global brain perfusion. So what we see here is that there's a reduced brain blood flows, and in passive heat exposure condition, you can see more prominent and widespread reduction in our brain blood flow. Correspondingly, we also noticed that participants actually perform poorer for cognitive tasks, where the error rate for a cognitive task was increased by 2.3%. So in the real world setting, an error rate of 2.3% means that out of 100 tasks, you will perform incorrectly about 2 to 3 tasks. And you can imagine that in the occupational setting, this will actually means that could generate safety problems and also workplace hazards, right? So since we know that the brain is so vulnerable and sensitive to heat stress, so what is the implication towards mental health, right? So there are already many studies out there. I'm going to just highlight a few that is looking at the association between climate change and human behavior. So as temperature spikes, what we see is that the suicide rates, crime and violence also increases. If you look in the middle, the assault rates actually increases in Australia. And on the left, you can see that the hate tweets and aggression, online aggression actually increases in US during heat waves. And if you look at the bottom right, the suicide-related mortality actually increases with the change in temperature. So in fact, they have found in US and Mexico that 1 degree Celsius elevation actually resulted in a 1% increase in suicide rate. So some might say it's just coincidence, right? All of these are just associations. But beyond emotional and behavioral changes, we're also seeing an increase in prevalence of mental illness with the increase in temperatures. So in Bangladesh, especially in the cities, they found that there's an increase in depression and anxiety prevalence. And this is a comparison to rural areas because temperatures in densely populated cities are actually higher due to urban heat island effect. So this is where the urban structures such as roads, buildings, and vehicles actually trap and release this heat. And therefore, cities are actually hotter than the rural areas. So even a 1 degree Celsius increase in this ambient temperature actually can contribute to a higher probability of experiencing depression and anxiety. So we do see many cases, more bipolar episodes, and also more hospital admissions during heat waves. So I think this points to a very salient message that our brain and also the mental health is actually very vulnerable to heat stress. So what's next for heat, brain, and mental health? So what we know is that it is likely to have more mental health issues in a warmer climate. But what we do not know or not so clear about is actually the mechanism of how heat actually impacts mental health, whether directly or indirectly. So areas that we can explore could be heat-induced neuroinflammation, hormonal imbalance, or even sleep disturbances, where we do know that hotter nights could mean poorer sleep, and therefore that could affect mental health. And the second point I want to bring through is the heat does not affect the society equally. So different people are affected by heat differently. And we should focus on vulnerable populations where we should work with more adolescents, youth, and older adults who face unique challenges with mental health. So the last message I want to say is that although we cannot change the fact that we are living in a hotter environment, but what we can do is to increase awareness and also start to take a preventative approach in this warming world that we are living in. And with that, I thank you for attention and I look forward to deeper conversations. Thank you.
Thank you, Xiangren.
And yes, acknowledgement, very important. Thanks.
Yes. Thank you so much for that. I'm especially interested to ask you more about the translational aspects of this research. Christina, if you'd like to go up to the podium. Especially for the occupational sectors and also how health systems can prepare for the increased burden that they're going to face. Take it away, Christina.
Right. So hi, everyone. I'm Christina. I'm pursuing a PhD at Duke-NUS Medical School, and I come from a background in psychology and as well as a master's in neuroscience. So today I will be discussing the emerging evidence concerning the intersection between climate change and brain health. So most of the research on climate change has been conducted on its links to respiratory and cardiovascular diseases, but climate change has recently been linked to mental and neurological health issues, including increased rates of anxiety, depression, and PTSD, along with greater cognitive impairment and neurodegeneration that lead to Alzheimer's, other dementias, and Parkinson's disease. Unfortunately, certain groups, such as children, older adults, and low-income communities, are disproportionately affected by the mental and neurological health impact of climate change. So in this review, we examined 6 different climate change-related factors: excessive heat, extreme weather events, air pollution, food security, soil and water contamination, and vector-borne diseases. The first 3 I will go into more detail later. And as for food security, variations in temperature and precipitation patterns associated with climate change affect agricultural productivity, which impacts food availability and quality. Elevated atmospheric CO2 has been shown to decrease the nutritional value of food crops, causing lower concentrations of essential minerals like iron and zinc. Malnutrition during critical developmental periods, especially during the first 1,000 days in an infant's life, can cause lasting cognitive deficits. Changes in precipitation patterns lead to more frequent floods and droughts and contribute to increasing contamination of water sources. Childhood exposure to certain environmental toxins such as pesticides and lead in water supplies has been linked to increased rates of anxiety, depression, and mood disorders in adolescence and adulthood. And it has also led to cognitive impairments, behavioral problems, and developmental delays. Finally, zoonotic diseases, including vector-borne diseases, or VBDs, are increasing in frequency and distribution as a direct result of climate change. VBDs can directly impact the brain, as seen in Japanese encephalitis, or cause neurological complications as a secondary effect, as in the case of yellow fever. These VBDs often cause degeneration of the insulating myelin surrounding neurons and neural inflammation. So climate change is increasing the frequency, intensity, and duration of heat waves. Significant temperature fluctuations strain the body's thermoregulatory abilities and can lead to heat stroke, seizures, and other life-threatening conditions. Heat exposure triggers neuroinflammatory responses, oxidative stress, and mitochondrial dysfunction, all of which are linked to neurodegeneration. During hyperthermia, the integrity of the blood-brain barrier is weakened, making the brain more prone to inflammation and toxins. High ambient temperature also tends to disrupt functional connectivity patterns in the brain, potentially leading to system-level brain changes that result in poor decision-making and impulsivity. Extreme weather events include droughts, floods, hurricanes, and wildfires, and are increasing in frequency and intensity due to climate change. Forced displacement, infrastructure loss, livelihood disruption, and financial costs are secondary stressors that contribute to anxiety, depression, and PTSD, with vulnerable populations facing higher risk. And over 7 million Californians affected by wildfires from 2011 to 2018 saw increased prescriptions of antidepressants and mood stabilizers. And extreme weather phenomena, including heat waves, cold spells, and severe storms, can also increase the risk of neurological diseases such as stroke, epilepsy, Parkinson's, and multiple sclerosis. Extreme weather events can also disrupt healthcare systems and interrupt the continuity of care for individuals already diagnosed with neurodegenerative disorders. And air pollution and climate change form like a reinforcing cycle. So many pollutants worsen global warming, and climatic factors such as heat and wildfire smoke degrade air quality, thereby amplifying health and environmental impacts. And air pollutants contribute to neurological and psychiatric disorders, primarily through oxidative stress and neuroinflammation. So PM 2.5 exposure activates microglia and it increases inflammatory markers. Pollutants, including micro and nanoplastics, disrupt the blood-brain barrier, allowing neurotoxins to enter and impair structural and functional brain connectivity. Evidence also links PM exposure to epigenetic changes in neurons, potentially affecting future generations. They impact brain health across the life course and are a growing risk for neurodegenerative diseases. So to address the challenge, we should implement policies and technologies to lower the emission of carbon dioxide, methane, and other greenhouse gases that contribute to climate change. We should expand the availability and affordability of mental health services, including counseling, therapy, and support systems that help individuals cope with psychological challenges. And we should create and promote urban community designs that incorporate elements such as green spaces, clean air, and access to nature, which have been shown to have positive effects on brain and mental health. So in countries besides Singapore, we can act across all levels of government. Municipalities can lead the way by implementing policies that reduce air pollution, enhance urban green spaces, and promote access to nutrition. Some national governments in turn can enforce regional regulations and implement regional planning efforts that prioritize environmental justice, ensuring that vulnerable populations benefit from climate adaptation policies. At the national level, governments can be tasked with strengthening air quality standards, supporting clean energy transitions, and investing in climate resilient healthcare systems. And multilateral cooperation further amplifies these efforts, facilitating shared knowledge, resources, and frameworks like the Paris Agreement to drive collective climate change. And so results of this review come from the Neuroclimate Working Group, which is a global interdisciplinary alliance of scientists, clinicians, policy experts, and climate advocates focused on the intersection of climate change and brain health. So please use the QR code to sign up if you're interested in joining this network. And you may also email Dr. Burchin, who leads the Neuroclimate Working Group. So thank you, everyone.
Thank you, Christina. And thank you as well for advocating for policy change. And yeah. Next up is the video address from Mathea, who couldn't make it in person, but will be presenting on her work with coastal communities in the Philippines.
Zealand. I'm Athea Melissa Lim, a development professional with a background in nonprofit work in the Philippines and academic research in New Zealand. And I'm really grateful for the opportunity to present the thesis from my Master's in Development Studies at the University of Auckland, titled Weathering Together, a study on climate change, mental health, and community resilience. I just want to take a moment to acknowledge the contributions of Dr. Jessie Hession-Grayman, my main supervisor at the University of Auckland, as well as Dr. Renzo Ginto and Dr. John Arruda, both of whom are prolific scientists and planetary health. Through their affiliation with the Planetary Global Health Program at the St. Luke's Medical Center in the Philippines, they connected me to the communities that I did fieldwork in. This is an original study that examines the mental health impacts of chronic climate change on coastal communities. These are typically underrepresented as climate vulnerable groups in mental health research, particularly fisherfolk. Additionally, most research from the Philippines is conducted in the aftermath of a sudden climate event like a singular typhoon, whereas this research examines slow onset climate events like sea level rise, increased heat, and increased severity of typhoons. Furthermore, most of the mental health research and disaster literature is clinical in that it seeks to quantify and diagnose. So I take a social development approach that challenges the medicalization of distress and suffering. My goal is not to diagnose mental illnesses in the community, but really to examine how mental health in the context of climate change may be embedded in oppressive social structures that harm people's well-being, which is what is known in global health as the theory of structural violence. The research took place in Ahoy, a rural municipality in the Philippines, which has been experiencing sea level rise, hotter days, longer hot seasons, and increased severity and frequency of typhoons. As a coastal community, one of the main forms of livelihood is fishing. So there are around 5,000 fisherfolk in Ahoy. They're small fishers that use boats under 3 tons and simple gear such as gill nets and stationary traps. There are no hospitals in rural settings like Ahoy, but there is a rural health unit financed by the local government. They have some mental health medication, but no mental health programs or facilities. So patients with severe cases need to travel to hospitals 2 hours away at their own cost. Among those interviewed were 39 fisherfolk, health workers, and local government officials to cover an array of insights from the bottom up and across key sectors through a combination of key informant interviews, focus group discussions, and individual interviews. Participants are all adults between the ages of 30 to 68 years old with deep lifelong histories in Ahoy to take stock of slow onset environmental changes that have transpired over time. And the findings were rich. So firstly, the research shows that yes, there are negative impacts on mental health. Participants put a name to these impacts into 3 categories. So chronic fear and anxiety, heat-induced distress, and hopelessness and depression. So in the next few slides, I'm going to be sharing snippets of their quotes as they can better tell you their story than I can. Chronic fear and anxiety was mainly triggered by increasing typhoons and floods. This community health worker talked about how her home was destroyed by heavy rains and flood, which you can see here in this photo. Now, whenever it rains and she hears the strong flow of water, she gets anxious. It's caused her to relocate and live with her family further inland. Participants also express forms of heat-induced distress, a phenomenon well-researched in climate literature. Studies show that exposure to high ambient temperatures leads to adverse mental health outcomes, such as incidents of mental illness. In this case, a community leader explained that her anxiety diagnosis flares up especially when it's hot, leading to panic attacks. Fisherfolk are especially vulnerable to climatic changes. This fisherman talked about how the rise in heat is causing fish to move to deeper parts of the ocean where simple fishing gear can't reach. There's a sense of helplessness about his ability to provide for the family now and for the future of their children. Now let's take a look at the coping mechanisms. What I found is that the building blocks to resilience consist of their ability to mobilize community resources and solidarity. These were often expressed in the sentiment that we can overcome anything. Let's take a look at the narratives. Social cohesion speaks of a sense of connectedness and willingness to share assets in a group. This is well researched in disaster literature in the Philippines. People feel that as long as they are with their loved ones, that they can overcome anything together. Acts of faith were also a key resource. The dominant religion in Ahoy is Christianity, so participants talked about praying for themselves and each other. In the second quote, the fisherman lives according to the Christian values of serving God by serving others in times of need. And as for the barriers, what was interesting was that participants could easily pinpoint the self-driven actions that helped them to cope, but not what hindered them. What they shared were vulnerabilities beyond their control, such as entrenched poverty and lack of social opportunities like education and alternative livelihoods, perceived as conditions that they have no choice but to endure. We see it in the first quote, a fisherman who is distraught that the poor are becoming even poorer in worsening environmental conditions. In the second quote, we hear from a member of the Fisheries Council who noted that fisherfolk already live in poverty. Many don't finish school and say they don't have other means of livelihood to provide for the family. And as a result, they struggle with helplessness. This is social injustice. People take it upon themselves to be resourceful in a world of climate change while subject to conditions of misery not of their own making. The global north is responsible for majority of global greenhouse emissions, while the carbon footprint of rural community members, such as those in Ahoy, is negligible, yet they're subject to the worst impacts. Their narratives of resilience are incompatible with Western notions of resilience. While their effort to mobilize is commendable, the patterns of systemic failures deny them the opportunity to move from surviving to thriving. Furthermore, their narratives of mental health are incompatible with Western biomedical models. Their mental suffering is deeply intertwined with their lack of social opportunity. For psychologists in the room, my takeaway for you is that social problems are not just external forces that act upon the mind. It's prudent to think about our psychology as having roots outside the body. In summary, we must pay attention to broken social systems and hold accountable exploitative actors that deprive people of the basic rights necessary to lead happy and healthy lives. It's not just a job for the health sector, but a collective responsibility for other sectors responsible for social freedoms. So that's it for my presentation, but there's so much more to say. I'd really love to connect. Feel free to get in touch through the info below if you want to talk more about climate health. Thank you so much.
Thank you to Melissa, who is unfortunately not in the room with us right now, but I really do hope you can reach out to her because she raised a lot of very rich points. And I want to just echo her call to kind of a collective responsibility and a shared understanding of what the climate crisis is, what are the problems exactly that we're tackling. Everyone in this room has approached it from a variety of disciplines. Thanks, Zach. From their own disciplines, understanding the impacts of climate change biomedically or socially, the impacts on individual and community well-being, as well as, you know, the neurological impacts of climate change, the physiological impacts. So one question that I'd like to ask the panel, as maybe everyone thinks of their own questions that we can collate later, is what do you think are the gaps remaining in evidence or translation in your own fields? So evidence gaps that may be preventing you from really understanding the pathway that you're trying to establish, or a translational gap where you have the findings, but translating it into policy or action that will bring about the urgent change that we really need. What's not there for you right now? So we can start with Hasham.
Yeah, thank you so much. And thank you so much for the question also. I will correlate this question with if there is a disease in your body and there are symptoms and still you're not taking any medicine. So it will, with time, it will worsen it. And it's a time to take the medicine and get rid of whatever you can do. It's not about, it's not about like we can do everything to change the climate again back to normal or something like this, but we can slow it down. We can at least do our part in it And as a researcher, I'm very happy to see other researchers also, like evidence is there. Everyone, every part of the world is there to say something about the climate change, and it's time for the decision makers to do something on it.
Um, Thank you for the wonderful question. Keep it up. Next question, please. I'm joking. Um, okay, so evidence gaps. Right now, I can think of two from my research. So first one is, as mentioned earlier, we use the climate change anxiety scale. This scale is actually a scale developed for originally for American populations, and it doesn't exactly capture the experiences of maybe Asian and especially Filipino experiences of climate change, because each population has a unique experience of climate change, right? And so there have been validation studies of the scale on Filipinos, and it has been found that it can be used, and yet it does not exactly capture the full experience of the Filipino youth on climate change. So I guess it would be nice if we could develop a scale that's specifically tailor made to the Filipino population, that is culturally appropriate, that is locally locally appropriate and localized, and so we could actually capture their experience. And the second is a baseline study, or the lack of a baseline data, because climate anxiety is still very very new. I think it's the first studies about it is around in the early 2010s, so not much data is available. And as of when we were writing our thesis back in 2022, we were actually still the third study who investigated climate anxiety among Filipinos. So there is a considerable lack of data, and without data, we can't translate this into action. And so yeah, those are the two that I can think of from our study.
Hi. Yeah, so for me, I think the gap is really we don't know what we don't know. That is really the problem here. The impact of heat on mental health is complex and multifaceted. There are many pathways where heat can eventually links to mental health problems. So we could have sleep problems, we could have inflammation problems, stress problems all together. But we couldn't really pin down on mechanism because it's not just one mechanism, it is many mechanisms working at the same time that's causing problems for mental health. And I think that is something that is causing us to have problems building an evidence base for people to tell, hey, look at this. This is the problem that we are facing. And these are the problem A, B, C, D that we should address right now. So I think this is really the biggest gap that we are facing so far. And another problem that I see is the spectrum that we are dealing with. So people who are on the healthier side with some mental symptoms, but we don't know whether the people with mental illnesses, are they also exacerbated in terms of symptoms under heat stress. So we are dealing with different populations across a different spectrum of mental health disorders, and also whether they are on the clinical side or whether on their healthier side. We are still having a lot of questions that we couldn't address. And I think we need to explore a bit further, and collectively, I think the evidence base need to be built by different groups, and we need to come together to actually make sense of what we have in terms of data. Yeah.
Yeah, thanks for the question. As mentioned, I think there needs to be a lot more research in lower income and resource countries. So in many countries in Africa, there's probably around one psychiatrist in 1 million like per population. So that's kind of like quite small. And I think the statistic is about like 1 per 100,000 mental health workers, including like counselors, therapists. So in contrast, in the global average is probably like 9 per 100,000. So there's a lot of things lacking in parts of Africa. And we need to do more research on more cost-effective ways to get mental health resources to those low resource settings. So one thing is really to look at technological innovations using AI. For example, AI therapists, like with apps like WISA, and just really seeing whether that improves mental health outcomes in those countries. We'll also need to find ways to increase access and affordability of mental health services. So of course, using telehealth and seeing whether that's equally as effective as like in-person therapy. And there could be more research on perhaps heat regulating supplements that protect the brain. Right now we know like magnesium, vitamin C, um, omega-3 would help with like regulating body temperature. And yeah, and vitamin B, of course, is involved in the regulation of the nervous system. But I think more basic science research so that we could develop like better heat regulating supplements that could cool the body.
Totally agree with you.
Thank you all for that. I know that we're running short on time, so anyone who has a question from the audience, we can. We have time for one question, I think. Yes. Okay. We can maybe collate the two questions. So please approach the mic over there. Yeah.
Hi, my name is Andrian from Indonesia. Question from Dr. Tan. It's an important and interesting research. The question is how then to apply your findings to protect the vulnerable groups like construction workers in Singapore who are dominated by migrant workers with limited resources. And for Dr. Akhtar, could you elaborate more? How did you collect the eco initiative? Because I didn't see the instrument that you used. And would the eco-initiative narrative different if you involve more female participants? Thank you.
And the second question.
Hi everyone, I'm Nagendra from Nepal. As you know, validity and reliability of tools is crucial for mental health research. So there is ongoing debate about the effectiveness and relevance of existing tools such as PHQ-9, GAD-7, to assess climate-induced depression and anxiety. So I'm curious to know about your experience of using those tools, and do you think that we need a separate tool to assess climate-induced depression, anxiety, or scale, or maybe we need a separate adaptation? So I'm curious to know what are your experiences. Thank you.
Yes. Last question.
All right, thank you. So my question is about accessibility of informations, because I found that these research findings are shows that there is an alarming effect of climate change on mental health, but sometimes these research findings can be not accessible to the general population, maybe due to paywall or other barriers. And so how do you as researcher overcome that, maybe advocate open access of information so people from general population also get informed about these research findings? Thank you.
Thank you. So some interesting questions on the translational aspects of Dr. Tan's research.
Yeah, so maybe I start first on the translational part. So I think the first thing is we want to take a very human-centric approach when dealing with, for instance, the occupational settings. So the very first thing I think that will really be helpful in terms of dealing with heat stress is actually aerobic fitness. So you got to be fit. So should be exercise regime that is really helping these construction workers or occupational workers to keep their fitness up. The second thing is about heat acclimatization. So you need to get used to the heat. So in order to do well in heat, you need to first get exposed to heat. So do it in a very controlled manners where you are exposed to maybe 90 minutes of heat stress over a period of 2 weeks, maybe every consecutive days. So that itself will build some resilience in the body. But of course, that's not always possible. So there are some measures that we have taken in Singapore. We have piloted some ways to actually use a cooling measure. So we actually introduced something called ice slurry. So it's just meshed ice, which have a very high capacity to cool the body. So we actually use these as a replacement for their fluid replenishment. So they are taking this ice slurry as a way to cool their body when they are in their resting state. So in some case, we also will advocate a work rest cycle. So it's important for them to know when they should take a rest, when they're exposed to high heat stress. But the fact is that work rest cycle has a direct conflict with productivity. So there are concerns by companies that they want to boost productivity, therefore they always shorten the rest and expand the work. So that's something that we can play around, but the one that we have piloted, at least in Singapore, for construction workers last year was actually using ice slurry. And then this has actually helped them to deal better with the heat stress that they are facing.
Yeah, and I think that that really highlights the difference between social and kind of biomedical understandings of climate change, because biomedically you may be addressing it with the ice slurries, but if employers and companies still have concerns about productivity and keep pushing workers, is the stress really gone? Yeah. I want to, okay.
Yeah, I would like to add a little bit onto that. So I currently my work is in out of hospital cardiac arrest, and we need to find ways to cool the body. Otherwise, the survivors will actually have really poor neurological outcomes. And so what we do is usually we have like cooling blankets to really protect them, and we've transitioned to having cooling vests. And so for construction workers, we could ask them to put on cooling vests during the day or cooling jackets that would cool their body while they're working.
Thank you. I want to make sure we address the other questions on measurement tools for mental health outcomes and eco-anxiety.
I totally agree with what Chris said about the tools. The tools, they are not they're not perfectly made for us, and we need to tailor them. And this study is part of, like, it's a pilot study, and the major goal is about to design what our area and what our people can do. And the other question involves the distribution among the male and female. It's the same case. Like, education is another case. With low literacy rate, you cannot take out what they want to say about it, and then the things change with the level of knowledge and understanding what you think about it. So we are in the process of developing some tools for our area and for our population, because this, as I'm from a global health department, and we work on other projects other than mental health also. So we are working on the hesitancies of vaccines. We are working on many other projects, and health literacy is one of the topic that is very much like required for our area, the remote areas of Pakistan. Yeah.
Tris, if you have any comments as well about the question on accessibility. Yeah.
Yeah, in terms of accessibility, I do agree that there is a challenge in terms of accessing data, especially journals with paywalls, and publishing open access is kind of expensive, especially from authors from the global south. So I'm not exactly sure if I can say this, but legally, do not use Sci-Hub. Like, don't use that website. It gives you access to journals, but do not use that website.
Nobody used Sci-Hub.
And maybe we could just start implementing like distributing flyers to schools, elementary schools, and really just start young so that like kids have access to like resources to like any updates in climate change as well as access to mental health as well.
I also want to jump in and call back to some earlier ideas in the earlier panels on um, the importance of community as well. The knowledge that many people around the world may have about climate hazards and how they're equipped to deal with them won't be coming from a journal article, for example. Research is important, it's not everything. It does need to be translated to communities, and there's a wealth of knowledge in communities that needs to be communicated in research. I think that's all. If you have any more questions, please do approach these panelists and please do reach out to Mathea over Gmail and LinkedIn, I think she provided. Thank you all for being here. Thank you.
Thank you, Tanika.
Thank you, Tanisha.